Another interesting case is also our CT tool. So I close the scoliosis patient and I'm gonna load the CT of the patient. Usually CTs of the chest are viewed in the axial direction, which is now starting to load. So this is just buffering the images and the proper view. Imagine you have a patient that comes in for checking the aorta, which is now in the view, or the heart valves, or if there's some lung nodules that need to be covered. People scroll through this kind of axial plane extensively in order to get any kind of calcifications in the liver and so forth, whatever the referring physician actually needs. And once they're done, they're reporting the organ damage, so to say. But what often is not happening is that people also scroll through the sagittal view and also make themselves a three-dimensional picture of this view. What you see here are 3 fractures in the spine, which could have been very easily highlighted by dragging and dropping our already prefabricated AI report. So what the AI did is check every vertebra in a 3-dimensional image, so not looking at one slice at a time as I'm doing right now, but the full vertebra at the same time in order to really detect if any of those vertebra has a dent at any of those sagittal slices. And again, it shows which vertebra were analyzed, the affected vertebra T5. So I would now here again have to actually label, okay, well, is this T5? Which one is actually T5? So I have to, so this one is T12, I guess, here. So I would need to, is that correct? T12. Yeah. So this one is T12, right? So you need to also then identify, again, this vertebral labeling has been taken care of, and more importantly, highlighting those vertebral fractures according to clinically approved scoring systems. And having many of these fractures would put this patient at a very high risk of a subsequent fracture, for example, of the hip, or higher mortality. So these patients have a much higher risk profile, which puts them at immediate need for checking for a vertebroplasty of the spine or a outpatient pharmacological follow-up treatment for an osteoporosis diagnosis that is done by, for example, blood markers and so forth. Good. So with this, you saw a triaging and fracture detection tool on CT.